8:30, and we are going to call the Senate Public Health and Welfare Committee to order. Today's more popular than what I was expecting, so welcome everybody that's made the drive or walk over to the Capitol to listen in and be in attendance to our meeting this morning. First thing that we are going to do is we're going to work Senate Bill 453. And Jenna with the Revisor's Office will give us a update, a refresher on what Senate Bill 453 is.
Thank you, Mr. Chair. Senate Bill 453 relates to unlicensed employees in adult care homes, and that bill would allow licensed practical nurses, would allow instructors of the training courses to be just any licensed nurse, and would allow simulation experiences to be up to 50% of the training course, and to have the skills demonstration be evaluated by a licensed RN or a practical nurse.
Okay. Committee, do we have any questions on the bill before we move forward? Okay, not seeing any. Committee, do we have any amendments for Senate Bill 453? Senator O'Shea.
Thank you, Mr. Chair. I do have an amendment. Jen, if we could hand it out, please. And essentially, it's taking out the part about the simulation. So we're focusing on allowing the LPNs to teach the courses and allowing the current simulation to stay the same.
Give just a couple more minutes or seconds to let everyone review it. Doesn't look too complicated. So, Senator O'Shea, was that your motion? Okay, so we have a motion by Senator O'Shea on the amendment and a second by Senator Petty. Any discussion on this motion before we take it to a vote? Senator Thompson?
Yeah, I'm just curious as to why, I mean, simulation experiences, are you just concerned, Senator O'Shea, about the amount of simulation being used in this, like 50%? I'm just curious.
Thank you, Mr. Chair. It seemed that there were some concerns around it, and the most important part is that we don't have enough instructors. And so the thought was, let's focus on the instructor piece for now. I know for the tech schools that would be beneficial, but the thought was just, let's focus on what's most important.
Senator Baumgardner.
Thank you, Mr. Chair. It's my understanding that there was discussion on Friday with different groups with regard to this amendment. There was significant concern coming from the community colleges with regard to simulation. I do want to make sure the carrier of this amendment indicated that I think her phrase was that LPNs, we're relying on LPNs for this instruction. And I think the reality is that is an option. The preference is always going to be that we use our RNs, but for those that don't have access to the RNs, we are allowing that LPNs can do that. And again, LPNs are certified. Registered nurses go through significantly more instruction and training before they earn that degree and that license. Thank you, Mr. Chair.
Any further questions on this amendment? Seeing none, all those in favor say aye. Aye. Those opposed, no. The ayes have it. This amendment is adopted. Do we have any more amendments? Senator Petty.
Thank you, Mr. Chairman. Actually, this one is not in writing, although I had communicated with the revisor, and it has to do with the title relating to unlicensed employees, and that would that any place in the bill where it says unlicensed employees, it would refer to certified aid. And
Mr. Chair, this is my fault. There was a miscommunication. So I I will be happy to prepare this amendment correctly and can answer any of the committee's questions. But it would just be changing that term of that employee to give it some clarification about what it's actually referring to.
So Senator Petty, just so make sure I understand and the committee understands, you're making a motion to do a conceptual amendment to have the reviser strike unlicensed employee everywhere there, that text is shown in the bill, and replaced with certified assistant or aide, certified aide. Okay. Do we have a second? Second by Senator Gossage. Any discussion on this motion before we take it to a vote? Senator Petty.
I will just share with the committee that I have actually talked to those in the industry about this particular title, and there was consensus among them that it was acceptable, so.
Committee, any further questions? Seeing none, all those in favor say aye. Aye. All those opposed, no. That amendment is adopted. Do we have any further amendments on Senate Bill 453? Okay, seeing none, what is the will of the committee? Senator O'Shea.
I move that we pass Senate Bill 453 as amended favorably for passage.
We have a motion on the floor by Senator O'Shea to pass out Senate Bill 453 as amended favorably for passage. A second by Senator Gossage. Any discussion on this motion? Senator Baumgartner.
Thank you, Mr. Chair. I would just like to voice, because it is, we had testimony on this particular bill where statements for proponents were made that everyone is in agreement, and I use air quotes for that, because what we learned is when we had testimony from neutral and opposition, that groups were not invited to the table for the discussion. There was not agreement, and I think that that's something that we, one, as a committee, need to always be wary of when people make those statements. We understand the situation that we're in right now, where we have limited resources, particularly in healthcare, and there is a need for that in our long-term care facilities. But it is disingenuous when groups that are active participants in training are not brought to the table for this discussion. I'm not convinced that we really have all of the agreement that's been reported that we have. I will not block this, but it does give me considerable concern that this was brought, I would say, prematurely before things were really ironed out. So it is disconcerting that from a healthcare standpoint, those institutions that provide the bulk of the training in our state were not at the table initially, and had to deal last minute with making the amendments and changes. So I don't think that, I think that perhaps we'll be coming back to address this in the future. Thank you, Mr. Chair.
Any further discussion on this motion? The only thing I would add is this is a Senate bill, and I understand Senator Baumgartner's concerns, and it will go over to the House. The House will have an opportunity to do the same thing. So we might see this in conference maybe. So any further questions or comments? Seeing none. All those in favor say aye. Aye. Those opposed, no. Senate Bill 454 as amended is going to the floor. Okay, committee, we will now turn our attention to Senate Bill 174. This is a bill that we had a hearing on last session. Jenna, can you give us an updated refresher on what Senate Bill 174 is, please?
Thank you, Mr. Chair. Senate Bill 174 is a bill concerning advanced practice registered nurses, and this had a hearing in our committee on February 18th of last year. And there was a lot of testimony from both sides, and this bill would essentially allow advanced practice registered nurses to practice without a certified or one of the agreements with a collaborative practice agreement with a physician, and to prescribe medications without that CPA, as it's referred to, and it would also require just certain certifications to be obtained by those nurses, and I can answer any specific questions. I don't want to go into too much detail if it's not needed.
Committee, do we have questions for Jenna on what Senate Bill 450 or 174 was? Okay, not seeing any questions, so we will now open up, and if you guys can remember back to, I think it was Thursday, I let everyone know about this bill and the way we're going to proceed. So at this time, we are going to have one proponent. They have 5 minutes to get up and talk and tell you why they like this bill. So who is speaking on for proponents? If you would state your name and who you represent, please.
Sorry. Mr. Chairman, members of the committee, my name is Nicole Lavanos. I'm with the National Council of State Boards of Nursing. Thank you for allowing me to be here today. I hope to present information today that will leave you not wondering what the outcome of this policy change would be, but to be confident that this policy change will result in greater access to care, in less unnecessary regulation, all while maintaining public safety and quality outcomes. We know this because with this policy change, Kansas would be the 25th state to remove these barriers on APRNs, and we have decades of evidence to show safe and quality outcomes. So first, this bill would increase access to care. We know that APRNs already practice in rural areas, including many of the rural communities across Kansas. There's about 9 nurse practitioners per 10,000 Kansans in rural areas. By comparison, the HRSA data finds about 6 primary care physicians per 10,000 Kansans in rural areas today. We also know from evaluating this policy change in the states that have moved that in Arizona, for example, the nurse practitioner workforce increased by 70% in the 5 years following the policy change, and that was in rural areas. In Nebraska, they also saw a significant increase in their APRN workforce, especially in 20 primary care shortage areas. Currently, 85 of Kansas's 105 counties are healthcare provider shortage areas. What if barriers were removed here? The Federal Trade Commission in their 2014 policy perspective found in their evidence that relative to primary care physicians, APRNs are more likely to practice in underserved areas, care for large numbers of minority patients, Medicaid beneficiaries, and uninsured patients. Next, we also know that this bill will remove unnecessary regulation. The FTC joins many other free trade and competition advocates recognizing that barriers like those in Kansas on APRNs are unnecessary, they restrain competition, and most importantly, they're not founded in public protection. The FTC concludes that restrictions on APRN practice should be no greater than the public protection mandate. In 2020, the FTC weighed in on the Kansas APRN legislation. One finding was that independent practice authority would help improve access to care, contain costs, and expand innovation in Kansas healthcare. They also found that regulation from the Kansas Board of Nursing for APRN should remain. Last and most important, Senate Bill 454 maintains public protection and quality outcomes. Boards of nursing charged with protecting the public agree with the FTC. Restrictions should exist if necessary to protect the public. As authors of the National Model for APRN Regulation, a model that sets the standards for education, licensure, certification, and APRN practice, boards of nursing lead in regulating these APRNs. And in every state that has made this policy change, APRNs are appropriately regulated by the boards of nursing. This bill raises the standards that APRNs must meet in Kansas. The bill ensures APRNs hold national certification, a measure of continued competency, and they join 48 other states in doing so. What we know is that when barriers are removed, outcomes are not impacted. APRNs continue to provide safe and quality care for patients, and more patients will have access to that great care. Members of the committee, the above benefits of this policy change are not supported solely by APRNs. I point you to the Kansas Chamber packets that show that this is not a healthcare practitioner turf war. In the packet before you are countless organizations supporting this change who represent business, regulatory reform, patient advocacy, in addition to Kansas's robust nursing community. The diverse coalition of supporters are here because they know this policy is right for Kansas and for their constituencies. Of course, we don't have to look far to find patients who rely on APRN care. Right here in Kansas, patients choose APRNs to be their sole care providers today. We also can look here in Kansas to see what this practice looks like, practice without barriers. The Veterans Health Administration, the Indian Health Services, and the United States military do not require these agreements in order for APRNs to practice. Lastly, this legislative body, like 12 others across the country, saw it fit to remove unnecessary restrictions on APRNs during the unprecedented health emergency in 2020. Unlike many issues where a state may be spearheading a policy change, this is not one of those. We have the evidence from nearly half of the states. We have decades of evidence and evidence right here in Kansas that show that this policy will result in greater access to care, reduce regulation, and safe and quality outcomes will be continued. Thank you for your time.
Thank you for your testimony. Committee, do we have any questions for the proponent? Senator Stephan.
Thank you. Quite a speech. There's a laundry list of items that you presented that are unsubstantiated and problematic for me. Particularly the studies showing the quality of care doesn't diminish. Did you bring those?
Yes, I can provide those for you.
I don't have those. I'll look forward to getting that. One of the other things, if I may, you talk about the VA and the Indian healthcare and the military, and those three entities throughout time have always struggled to find providers, and their crossbar has always been lower than anybody else's, and so I find that a bit of an issue. We could go on, and I won't. The one thing and this is a turf war, make no mistake. When you look at the people who are supporting this bill, to a person, it's an independently practicing practitioner. And the CEO of the Kansas Chamber, his wife is an independently practicing APRN. So I don't think anybody should be confused about those issues. The other issues that's incredibly important to me is you did say expand innovation. And I pray that's the case. I pray that nurse practitioners could remain independent from what we saw through the last 2 years, where there was one liberal academic healthcare narrative that strangled the provision of care in relation to COVID. I pray that you guys can do that and bring that to the table. So with that factor alone, the opportunity to create another narrative, there is worth in this bill. And I appreciate that. Thank you.
Any further questions for the conferee? Senator Petty.
Thank you so much for being here. And I know that we've heard testimony before concerning the scope of practice, and you mentioned that again in your testimony. So an APRN, when we talk about the scope of practice, could you expand on that?
Yeah, so the APRN scope of practice is.
If you wouldn't mind for those online, restate your name.
Oh, yes, sorry, Nicole Lavanos, National Council of State Boards of Nursing. Thank you for your question. So the APRN scope of practice is dictated by their training as a registered nurse, then their advanced graduate level or master's training as an APRN in a specific role in population. So they're educated in a very narrow lane, and then they hold national certification. This bill would require national certification to be held by APRNs, but we know the vast majority, probably upwards of 90%, already do hold this as a requirement for their employment. And within that certification, they must remain in that lane. So again, their education and training allows them to diagnose, to treat. Those are things, and prescribe, and those are activities and services that they're providing and Kansans are relying on today. This bill does not make a change to that scope of practice. It removes an unnecessary barrier that they hold a collaborative practice agreement with a physician in order to practice to the full extent of their education and training. But it will not change the services that they provide, the care they provide for patients, nor the prescriptions that they can prescribe.
Thank you.
Committee, seeing no further questions for the conferee. Nicole, thank you very much for your testimony. Okay. Committee, we will now turn to the opponent. Who is speaking? Rachelle? Welcome to the committee.
Thank you. Good morning, Mr. Chair, members of the committee. I am Rachelle Colombo, Executive Director of the Kansas Medical Society. I've provided to the assistant the testimony we were allowed to bring, told to bring it today, so I'm sorry if there was some misunderstanding. I didn't believe we were submitting testimony, but I'm here today on behalf of the Kansas Academy of Physician Assistants, the Kansas Academy of Family Physicians, the Kansas Chapter of American Academy of Pediatrics, and of course, the Kansas Medical Society. And the most important thing I can tell you today is that I sincerely wish that this was a hearing on the new bill, Senate Bill 454, and that we could come to you today as neutral conferees. I've stood before this committee many times on issues relating to scope of practice, and it is always our desire to work with the other side to allow the professions to come to the table and to guide you in a way that resolves those differences between the professions before we're in the legislative environment. We've done that with occupational therapists. We've done that with pharmacists. We've done that with the podiatrists. We've done that with the physical therapists. We've done that with most every group that has come to us in search of an expanded scope of practice. Our position is simply that we will not support the unsupervised and unrestricted practice of medicine. Regarding the questions on scope of practice, I understand the statements that have made and what could result in some confusion regarding what a APRN is allowed to do today and how that would change under Senate Bill 174 or potentially Senate Bill 454. And again, I think it's important to note, while this may not be a hearing on Senate Bill 454, it's my understanding it will be considered today and potentially worked out. That bill includes new language that we have not seen since until 10 days ago when it appeared in the calendar. We spent the bulk of last year and many years prior meeting with the APRNs and their proponents to discuss the merits of proposals like Senate Bill 174 and those that came before. And we met with them all the way through May of last year and included, and we offered to them at the end of the year, as we had tried to find some middle ground, language that it would have removed the collaborative practice agreement, which they present as the barrier to care, but would have provided distinctions in the scope of nursing and the scope of medicine. Those proposals have been rejected, and we do not have a compromise. We do not have something before us today that represents a distinction between the practice of nursing and the practice of medicine. And the most specific, I think there are potentially some merits to Senate Bill 454 that we would really like the opportunity to sit down with the proponents and discuss, because I believe today, as I have believed before, that there is a way to move forward that distinguishes the practice of medicine and the practice of nursing and allows for the independent practice of nursing. But I don't believe that Senate Bill 174 or Senate Bill 454 represents that. And the most specific reason why is it doesn't have limitations. It has express authority to do certain things, and that's a good start. But it doesn't have limitations that we see for other professions that distinguish them from the practice of medicine. And so that is the primary reason for our opposition today. We would really like the opportunity to work on this and to address the concerns and the premises that have been brought before you for the need for this. The Kansas Medical Society is not opposed to the independent practice of nursing. That is not what this bill represents. We would love to have a hearing on Senate Bill 454 and the opportunity to move forward and come to you with a compromise or at least the removal of our objections. And I'm happy to stand for questions. Thank you very much.
Rachelle, thank you. Committee, questions for the opponent? Not seeing any. Thank you. Oh, wait, just a second. Senator Gossage. She was in my blind spot, sorry.
Thank you, Mr. Chair. Thank you for being here. You know, I know that this bill has been before this committee, I don't know how many years now. And I know that you were asked by the House and leadership in the House to come together, work things out. We've not seen that happen. Would you mind sharing with the committee when you said the difference? Because what I understand is the difference was that you would like APRNs, if they're going to work independently, but they could still, of course, refer and work with a physician without a contract. Can you explain to me how it is that, what are these parameters or the list of things that you're like, these are the things we would have to see before we become neutral or proponents?
Absolutely. I appreciate that question. And I do want to clarify, it might sound like a distinction without a difference. The issue of independent practice of nursing has come before the legislature for about 30 years in a row. The bills are always different. The position that we've had from the beginning is if we're going to remove the collaborative practice agreement, we just need to distinguish between the professions. And again, we do this in other areas with other professions by saying, these are the limitations on prescribing or on what kinds of treatments. We did that last week with the occupational therapist. So last year, yes, we were asked by members of the House and Senate leadership to get together and to see if we could find some common ground. And we met earnestly and exhaustively throughout the session last year. And part of the way it was just candidly framed was, could we extend the emergency order, because that allowed for, there's no collaborative practice agreements required under what is now 2274. One of the provisions that's included, though, in that is that those individuals are working in medical facilities. They're working under physician direction. So it's not as simple as just the collaborative practice agreement, which is, I believe, the way this has been talked about in the past. There are other ways, I think, to ensure for patient protection, to ensure collaboration outside of the collaborative practice agreement. That's the model that has been used for the APRNs. But one of the things that we offered last year was that we could remove the collaborative practice agreements for any nurses that are employed or working in medical facilities, because that inherently involves physician direction. Alternately, for the small number that are likely to want to practice independently, to have a defined scope and practice. Just so that nurses, not all nurses would have to be, for instance, licensed under the Board of Healing Arts, as would be our preference if they were going to practice independently, but only those who seek to work outside of physician direction. And one of those limitations would be not to do invasive procedures, and a list of, in fact, procedures and defining what would be, there's a difference between potentially removing sutures and inserting a femoral line. Those are important distinctions. And nowhere in the law, in what's presented in either Senate Bill 174 or Senate Bill 454, is there anything that would bar an APRN from anything that a physician does. It expressly allows for prescribing, but it does not in any way limit them from doing anything else, including procedures.
If I may follow up, Mr. Chair. So it sounds to me like when you were saying we would like to have more time to maybe come together with the collaborative agreement, do you really think more time would make a difference?
I appreciate that question. We were very disappointed. We were very disappointed at the end of last year, particularly that when we heard from in front of the House committee from 27 different proponents that the number one barrier to practice and to access in Kansas was the collaborative practice agreement. And we brought forward 2 different proposals to remove the collaborative practice agreements. And the response from the proponents was, we don't want that. We want the unrestricted. We want unrestricted and unsupervised practice. And those are 2 different things. So what I would posit to you is we believe there is a compromise path forward. We don't support that. But if the real issue is independent practice of nursing, I absolutely believe that there is a path forward that would respect those differences. And again, simply in the law, respect the difference between the practice of nursing and the practice of medicine, and neither of these bills does that. We have been at the table looking for ways to remove the collaborative practice agreement and to allow the nurses to do what they have said they would like to do here, but they have not been wanting to define in the statute what that scope would be and how it would differentiate. And we believe that's the crux of this issue.
So my final question is statement is what I'm hearing is the deal breaker is come under the Board of Healing Arts or we don't agree.
That's not what we offered them. 2 different models last year. Again, there's a way, I think, to dissolve the collaborative practice agreement, but there has to be something. Our preference would be that they come under the Board of Healing Arts. But if they are not under the Board of Healing Arts and are working in a medical facility, they would not need to apply for an independent license under the Board of Healing Arts. I'll also tell you that the language in Senate Bill 454, we've had just a few days to look at it, and I've had no discussion from the proponents. It's a different model that they've never offered before, the national certification. It seems to mirror somewhat as done through for the CRNAs, who have more independent authority, and I would appreciate the opportunity to understand it better, but there hasn't been a hearing on that bill.
Thank you, Mr. Chair.
Committee, do we have any further questions? Senator Baumgartner.
Thank you, Mr. Chair. Rachelle, could you share with us what the position is with regard to the added curriculum on pharmacology. That seemed to be a sticking point, that they needed to have more training in pharmacology. So where do the associations that you represent sit with regard to what's now being offered as far as advanced pharmacology content?
Is that language under Senate Bill 174 or Senate Bill 454?
Well, I'm looking at what Carol Moreland provided, Executive Administrator for the State Board of Nursing. She says the subject is 454, but it simply identifies the additional 3 credit hours that Fort Hays State, University of Kansas, and Washburn are requiring, and then the 6 credit hours that Wichita State are requiring. I was just curious if you had looked at what that increased training, though I see it as just one course. I don't know that 3 credit hours is extensive pharmacology content or much more pharmacology content. But I was just curious where your association is on that.
Well, it's our position, of course, that training and education matter, and that's why there are distinctions in the different healthcare provider types and what services they may offer. Again, Senate Bill 454, it's my understanding, we haven't had a hearing on it, so I haven't spent a lot of time with that and haven't had a chance to meet with the proponents about it. We're working Senate Bill 174 today, as I understand. We do think that efforts to increase training are positive, but they're not equivalent to physician training. And so to the extent that is the basis for independent practice that would allow for the same privileges, I don't believe it would be sufficient.
Thank you. Thank you, Mr. Chair.
Senator Erickson.
Thank you, Mr. Chair. And I'm just sitting here trying to absorb the testimony because I'm hearing on one hand that this does not expand the scope or practice of APRNs in any way. It's simply allowing them to get out from under the collaborative practice agreement. But then I'm hearing a lot of concern about they would be free to do procedures and such. So I'm not sure what is can you help me understand that, because I'm hearing mixed messages.
I agree. I understand. I think that's one of the hardest things about this issue to understand is that the privileges, and I'm going to use a totally charged term, but this is part of what you all have discussed before, which is delegatory authority. So APRNs or physician assistants, they do have the ability to do delegated medical acts because those acts and their outcomes fall back on the physician at this time. The thing that allows for that is the collaborative practice agreement. So right now, yes, APRNs are able to prescribe. They have limitations on prescribing, but they are able to prescribe, and they can do certain things in office settings under the physician's direction. The physician may or may not be present. This is different for nurses than it is for physician assistants. So their scope of practice right now, the things that they are explicitly authorized to do under the law now include limited prescribing. But if you remove the collaborative practice agreement, they're saying we already do those things, that's already our scope of practice, but that's granted under the physician's privileges. So it is different. If you remove then the collaborative practice agreement, the physician no longer has responsibility, accountability for those acts, and how that translates is their license, their malpractice, and their regulatory body, the Board of Healing Arts. This is why we believe so strongly that any profession that is actually doing delegated medical acts or independent medical acts ought to be under the Board of Healing Arts, is because that board includes physicians who are trained in the practice of medicine, so they're appropriately able to regulate it. But if you go to a different board that doesn't regulate the practice of medicine because they're not trained in the practice of medicine, you have ultimately 2 different tiers of that patient care.
Quick follow-up. Would anything in the legislation or the bills that we have before us prohibit an APRN from voluntarily working under a collaborative practice agreement?
No, it would not.
Thank you, Mr. Chair.
Senator Petty.
Thank you, Mr. Chair. Rachelle, thank you for being here as always. You mentioned about the, about medication. And so when the bill talks about such licensees' specific role and population focus when it comes to administering any drug, so how does that, if they have to work within their specific scope of practice, then how does that expand what they're doing? Or how does that go against what you're talking about?
So, Senator Petty, I believe you're referring again to Senate Bill 454. Is that correct?
I am.
Yeah. Again, this isn't a hearing, and I wish that it were, because I do believe that there is some language under Senate Bill 54 which is improved, and that creates a better basis for getting closer to distinguishing between the practices. We haven't had a hearing on that bill, and we haven't had an opportunity to talk with the proponents about those provisions. So I think that shows a little bit narrower focus. It should be a better application of their skill set as it relates to their population focus, but we haven't had opportunity to discuss that in a hearing form. It's something that should be fleshed out.
Just as a follow-up, I know that this, I've been in these hearings before, and I know this is, as you just mentioned in your testimony, that this has been something that you've met about and that you've both sides have talked about. So you're telling me in that conversations, it's never come up about they're working within their scope of practice when it comes to medication?
No, it has. It has. And we've asked for language that would clarify that and would more, again, so this, I think Senate Bill 454 shows some movement there. And again, I think the distinction is it provides explicit authority, but not limitation. In this instance, it says they may prescribe within their population focus, and I think that's a move in the right direction. But the other side of that coin is it doesn't also have the limitations on what they cannot do, and that would be beyond prescribing as well.
Thank you.
Rachelle, how long has the Aprn issue come before the legislature?
Well, it exceeds my, I've been a part of legislative process for 20 years this year. I've been with the Kansas Medical Society for 10, and every year that I've been here, there has been a proposal. They have varied in content. They have varied in training requirements and in everything. They have not, in my tenure, included any limitations on scope, which we think is critical.
Senator O'Shea.
Thank you, Mr. Chair. It's my understanding that they already have scope, that they're required from the Board of Nursing. And so I guess I don't understand. I mean, they're already limited to that, and they're already following that.
I think, to Senator Erickson's point and to your point and the way it's been presented, that is a common misunderstanding. But the scope is not defined in statute, which all other healthcare professions are.
Any further questions for opponents? Okay, not seeing any. Rachelle, thank you. For those of you listening online or in the audience that's kind of relatively new to this long-lasting turf battle we're dealing with today, I came into the legislature in 2017, and every year we've had a hearing on this issue or in one chamber or the other. They actually had a vote in the House. It was actually a gut and go. For those of you that remember that Medicaid expansion got put into that bill, and I believe it was 2018 that happened. So this is not a new topic, and I kept hearing, I wished we had a hearing on this. If you guys remember back to the last day of session last year, I made this comment, and this is still going forward. We didn't get a chance to work every turf battle, but if there's a turf battle that has been going on for 10 years or more, I would highly recommend both sides get together, because we are going to work those bills. No ifs, no ands, no buts. Eventually we are going to work them, because we are going to quit having testimony or hearings year after year on the same issue. And that's what we're going to do today. So, committee, do we have any other questions or comments? Senator Gossage.
Mr. Chair, may I ask a question of the proponent?
Nicole, are you still here? Yes. Senator Gossage.
We were told by the opponent testimony that there didn't appear to be a scope of practice. Could you address that as far as staying within a scope of practice outside of that agreement?
Yes, thank you. So the scope of practice for APRNs is again defined by their education, their training, and their licensure, which is under the Kansas Board of Nursing. So they are allowed to diagnose, to treat, and to prescribe. Those are provisions that are under the Kansas Nurse Practice Act that permits them to practice to the extent of their education and training. Their scope is limited. If they exceed their scope, that would come under the disciplinary functions of the Kansas Board of Nursing currently, and this bill would make no changes to that. So presumably that would continue should they exceed their scope of practice. I think the senator brought up the population focus, the role in population. That is clarifying language. That is already what APRNs must do. They must stay within their lane. And this clarifies that for a prescriptive authority, which of course this collaborative agreement is tied to in statute, that they would continue to only prescribe within that their population and role.
And to follow up, if I may, Mr. Chair, in nurses in other states who have this independent authority, and they find that it's outside of their scope or there's an issue with the patient, what would they do?
Yeah, thank you for your question. So what APRNs would do is what they would do today. Their collaborating physician is not necessarily always the best and right person for their patient who they need to refer something to or escalate to. So they would look to other members of the healthcare team, not necessarily even physicians, depending on what their patient's needs are. They would collaborate with them. They would refer. It's unfortunate that collaborative practice agreements, that word collaborative is in there because healthcare practitioners have to collaborate. That is part of their training. It's part of their education. It's part of their duty to their patients. So by removing a collaborative practice agreement, you are not removing collaboration. And again, we have 24 other states and examples where certainly physicians and APRNs and nurses and other members of the team are still working together to meet the patient's needs.
Last question, could you tell us the primary reason why an APRN would want to be out from under a collaborative agreement?
Yes, thank you for that question. And I would say that it's not just APRNs that would want to be out from under the agreement, but the benefits of that reduced unnecessary regulation, the increased healthcare competition, in addition to those practitioners that face challenges. Your license is essentially tied, your ability to work is tied to a contractual agreement with a physician. And so that can cause challenges for access to reach, to find those physicians, to enter into those agreements. To maintain those agreements should, for example, a physician retire. We know many examples of when a physician's license is either not renewed or they retire or something else happens, an administrative error occurs, upon their renewal. And that APRN is no longer able to see their patients, to provide care that very moment. So there are real challenges. And there are also additional cost challenges that can run with the collaborative practice agreements as well.
Thank you. Thank you, Mr. Chair.
Seeing no further comments or questions, we will now move our attention. We are going to actually work a bill, and we are going to work House Bill 2279. For those of you that don't know what that is, don't get too worried because I'm going to make a motion that we insert the contents of Senate Bill 454 into House Bill 2279. Oh, strike the contents of House Bill 22. Thank you, Jenna. House Bill 2279 and insert Senate Bill 454. I have a second by Senator Erickson. Any discussion on this motion before we take it to a vote? Seeing none, all those in favor say aye.
Aye.
Those opposed, no. The ayes have it. Okay. Do we have any amendments for House Bill 2279? Senator Erickson.
Thank you, Mr. Chair. And Jenna, if you would please hand that out.
Senator Erickson, would you like to explain your amendment?
Yes, thank you, Mr. Chair. This is language that is in SB 174 and House Bill 2256, the previous APRN bills that was not in this specific bill, and it simply clarifies that an APRN should not prescribe any drug that is intended to cause an abortion.
And is that your motion?
Yes, move that amendment.
Have a second by Senator Baumgartner. Any discussion on this motion before we take it to a vote? Senator Petty.
Thank you, Mr. Chairman, and I'll ask Jenna this on page 4 of the bill, the H section, so that's 65-4A08B. Could you explain what's in there?
Yes, thank you, Mr. Chair. Jenna Moyer, Revisor Statutes Office. KSA 65-4A08, subsection B specifies that it is unlawful to perform an abortion in a facility unless you are a physician that has admitting privileges at the, I think it's hospital within 30 miles. So it just clarifies that advanced practice registered nurses could not perform an abortion.
Any further questions on the amendment? Seeing none, all those in favor say aye. Aye. Those opposed, no. That amendment is adopted. And I do have an amendment as well.
Do you need another? We can share. Okay.
Committee, what this amendment does, it clarifies that a APRN would have to do any drug that is controlled substance shall be prescribed, procured, or administered in accordance with the Uniform Controlled Substance Act. And that is all this amendment does. That's my motion. Second by Senator Erickson. Any discussion on this motion before we take it to a vote? Senator Petty.
I'll just ask you as the maker, so I'm going to assume that this actually doesn't change anything, that this is...
And I am going to defer to Jenna because she's a lot wiser on this amendment than I am.
Thank you, Mr. Chair. This technical fix was actually suggested by the Board of Pharmacy as a clarification. The current language could imply that APRNs were only allowed to prescribe drugs that were listed in the Uniform Controlled Substances Act, which was not the intent of the bill. That would exclude certain things like antibiotics or statins, was my understanding. And this would clarify that an advanced practice registered nurse could prescribe any drug, period. And then any drug that is on the controlled substances list, you'd have to follow the statutory requirements for that. And so it is a technical clarification.
Thank you.
Any further discussion on this motion before we take it to a vote? Seeing none, all those in favor say aye.
Aye.
Those opposed, no. That amendment is adopted. Do we have any further amendments? Not seeing any. Committee, what is the will of the committee? Senator Gossage.
Mr. Chair, I move that we pass out House Bill 2279 as amended favorably for passage.
It will actually be a Senate substitute.
Substitute Bill 2279 as amended favorably for passage.
Jenna, will it still be as amended even though we're doing a Senate substitute? It'll just be a Senate substitute. Okay, so we have that motion by Senator Gossage, second by Senator O'Shea. Any discussion on this motion before we take it to a vote? Okay, not seeing any. All those in favor say aye.
Aye.
Those opposed, no. Okay, the motion passes. The bill is going to the floor. Senator, would you like your vote recorded? Okay. So just to clarify, this is going to be Senate substitute for House Bill 2279. It could be amended or as amended or not, or just Senate substitute. Okay, so it should just say Senate substitute for House Bill 2279. Committee, is there anything else come before the committee? Seeing none, we are adjourned. Thank you but before we adjourn, I need to back up just a minute. For those of you that come in and watch or listen online, I know I've given kudos to our staff before, but this week and the last week of session are very time-consuming for them. I know that one of the amendments came out after midnight last night. So while we were sleeping, they were working. So again, thank you, everybody, for your hard work. And we will see you next Tuesday, March 2nd. So thank you. We are adjourned.